Good afternoon. Welcome to the webinar from the National Governors Association on Prenatal to Age 3 Policies, Summary of an Expert Roundtable Discussion. We'll begin shortly, so stay tuned. Good afternoon, everyone. Welcome to today's webinar. Again, the topic is Prenatal to Age 3 Policies, Summary of an Expert Roundtable Discussion. So we will get started now, and if you have any questions from now moving forward through the webinar, please use the chat box feature. Also, this session is being recorded. At this time, I'll hand it over to Mandy Sorgi, our Senior Policy Analyst for Early Care and Education.
Good afternoon, everyone. We'll start with a little bit of an overview of NGA for those of you on the call who aren't as familiar with our work. So NGA is the collective voice, a nonpartisan organization, which is the collective voice of governors for our nation. Our members are the 55 states and territories and the Commonwealths. And we're really here to support governors and their staff on policy issues and serve as consultants. And just so you know, we do have an organizational structure that has two sides, our Office of Federal Relations and our Center for Best Practices. We'll start out with talking a little bit about the Education Division's 2020 strategic plan. As you can see, the 5 initiative areas are human capital, standards, assessments, and accountability, governance and finance, personalized education, and whole child. We also have 3 core principles that guide our work, which are data-driven, equity, and alignment. And the work we're talking about today falls under our governance and finance initiative. So to break it down a little further, you can take a look at our current and proposed projects. As you can see under the governance and finance initiative, we do have this project that we're talking about today around integrating and aligning prenatal to age 3 policies. We also have some current and coming up projects listed here for you all to see. We also want to let you guys know about our governor's response team. Our governor's response team is kind of a one-stop policy shop for governor's offices, and in our case for our education policy advisors within governor's offices, to come to NGA with questions around policy and research, and we provide rapid response solutions for those governor's education policy advisors. This is a map of our governor's response team in action, specifically around early childhood education. So as you can see from the map, we've had several states call in, email in, ask that we come out and do a site visit all around early childhood education. Specifically, here are some pictures from the recent Louisiana Early Childhood Summit. This was a governor's response team visit from our early childhood team. We partnered with the National Conference for State Legislators, who are also pictured here, to move forward the development of an early childhood education commission in the state. You'll see in the center we have our governor's education policy advisor, Donald Sanji from Louisiana. So we came out to kind of help Donald with that, and we partnered again with NCSL to move that work forward. So today, the bulk of what we'll be talking about centers around our expert roundtable on integrating and advancing state prenatal to age 3 policies. This is a 1.5-year project around this topic, and it began with this expert roundtable co-hosted with the Harvard Center on Developing Child on June 4th and 5th of this past year. This map displays the states who either sent a governor's education policy advisor or someone else from a children's cabinet or a state agency to this particular meeting back in June to learn more about what's going on nationally and some of the research and best practices around prenatal to age 3 policies. And this is a photo from that event. And just so you know, some of the topics that were covered at that event were ensuring healthy outcomes for children and families through state policy, home visiting, making connections and leveraging evidence-based opportunities for infants and toddlers, and then early childhood education, how states can increase high-quality, comprehensive prenatal to age 3 education policy programs. And then, as you'll hear more from Beth Karen in just a minute about the actual report from this event.
Thank you so much, Mandy. So I'm Beth Karen from the National Governors Association Division of Education, and I just want to give you a little bit of background about the actual report that we've just posted. This report is available on our website. There's a link on the screen, but we'll also be sharing around resources that will be included in this webinar and the webinar slides as well. So you'll have access to this report, which is on our NGA website. And the lessons learned from this report we gathered together into a summary document. In the roundtable, the group discussed the key elements and policy levers that states could use to further an agenda to support infants, toddlers, and their families in the states. With all of the attention on early childhood in recent years and with the importance of these early years, we wanted to make sure that there were efforts underway to address our youngest population. So a summary of the roundtable discussion was developed by Deborah Stark, an independent consultant, and we received financial support from 0 to 3 as part of their Think Babies campaign. You'll hear more about the campaign from Barbara Gebhardt shortly. The high-level elements of the report, we tried to capture the policy components that were important to think about in driving prenatal to 3 policies. We wanted to ensure that children and families were at the center of all of the work, that they are part of a community, and that we take that community context and family context into consideration. It was also very important in our discussion to think about integrating the various systems that currently address and provide services to children and their families in the earliest years. So integrating health, early learning, and child welfare systems together. In aligning these early systems, we want to think about reducing the stress on families, streamlining efforts, maximizing resources. And in order to do that, we need to develop a vision for integrating the Prenatal to 3 Policy Academy across these various systems. And some of the essential elements that we thought were critical as a group in truly integrating policy agendas would be thinking about the preventative supports and services that are offered to families, integrating those services in terms of aspects such as the eligibility criteria that we use for various programs, centralizing intake processes, integrating data systems so that we really understand who's being addressed and who's being left out of systems. Differentiating services based on unique family needs and contexts is also a critical aspect of an integrated vision. We also know that sustainability of supports and services is critical, not only in terms of financial sustainability, but also in terms of the human capital that's necessary to make these investments last. And lastly, but not least, innovation. A lot of the discussion in the expert roundtable centered on the research that we know exists in investing early in young children's lives and the significant long-term benefits that are available to them as well as their families and society at large. But we also know that we need more information on which children benefit from which services, under which conditions, and at which times. And we might need more innovative solutions to think about what those right services are and for whom, so that we can get services to children in a timely manner within a model that is focused on continuous quality improvement. So let's take a little look at some of the policy levers that came up in our discussions, but also that we know from our experience are important to think about as you're building an integrated Prenatal to 3 policy agenda. These different levers are grouped into various groups, but we also know that there's a lot of overlap and integration across these already. Some of the policy levers that states can consider using and enhancing to support infants and toddlers and their families include the governor's levers of staff appointments to various positions, using their power to convene groups and stakeholders, the bully pulpit that they can use to send messages and emphasize the importance of these early years. There are also health, early learning, and human services policies that you can see listed here that are also included in the report. Some examples are infant and adult mental health programs, health programs such as CHIP, EPSDT, and TANF, and Medicaid expansion services, nutrition programs, CCDBG quality set-aside dollars, Individuals with Disabilities Education Act, Part C child find services, expansion of Early Head Start, the new birth to 5 preschool development grants, which will be issued in December of this year, home visiting programs, including the MIC-V programs, and policies such as paid family leave. So those are some of the levers and visions that the prenatal agenda can keep in mind, and we'll be transitioning now to some of the steps that NGA is undertaking to engage in the next few months, next year, to support families in these efforts. So with that, let me turn it over to Tiffany Ferret on our early childhood team at NGA to talk about some of these upcoming activities.
Thank you so much, Beth. So as mentioned in our wheelhouse of work, one of the next immediate steps that we're taking in the prenatal to age 3 space is hosting a learning collaborative to convene not only state participants, but experts from education, human services, and health to be able to prepare states in this work and to support governors and their staff. As the new class of governors and their staff come on, we want to make sure that we have all the information that we can give to states so that they can best support the children and families in their states. So to give a little bit more background, we went through the report, but we know from research that development in the first 3 years of a child's life is very important for their brain development. And knowing this, it's critical to provide high quality services to children and their families, not only for them, but for society at large. So some of the returns on investment that we see are reducing crime, social services, and other things. And we will have this convening in New Orleans from January 7th through 9th of next year. So that is one of the first convenings that we have. Next, I'm going to go through our timeline from 2019 into 2020, which actually finishes our 2017 to 2020 strategic plan. So to start in January 2019, we have our Learning Collaborative that I mentioned. But then after that, we'll have a Policy Academy begin from March and into May. We'll have site visits throughout states to be on the ground with governors and their policy advisors. Also in May, we have a Governor's Education Policy Advisors Institute Boot Camp. So this will be a meeting for governors and their staff. As we mentioned, a new class is coming on, so we'll be able to provide relevant information to staff so that they can best assist their governors in their state. In September, we'll have a larger convening, our Governor's Ed Policy Advisors Institute, which is our annual institute where we share information from various sectors of education. So not only early childhood will be provided, but K-12, higher education, and other topics in education for governors and their staff. In November, we'll have the prenatal to age 3 cross-state convening. So to continue this work in the prenatal to age 3 space, we'll convene several states together to be able to provide a peer learning opportunity for these states. And then moving into 2020, the Policy Academy will conclude in April. So during the time between the cross-state convening and April 2020, there will be additional opportunities for learning. NGA will be able to provide materials, resources, and other support to states before the conclusion in April 2020. So now I'm going to hand it back over to Beth for some announcements.
Thank you, Tiffany. So I want to, as Tiffany mentioned, this NGA-sponsored Learning Collaborative in January 2019 and the Policy Academy that will begin in the spring of 2019. Both of these opportunities need to be coordinated through the governor's office and include the governor's education policy advisor. Our hope in those events at the convening, which we will host up to 12 states to send 1 or 2 or 3 state members to that team. The goal of that is to build on the lessons that we learned in the expert roundtable and that are highlighted in the report that we just very briefly went over, but that you can also take a look at on your own, is to think about the different policy levers that a state could consider, but also to bring examples of states that are already doing work in some of these areas so that we can find ways to enhance those and to integrate them across different systems. And we know that the timing of both the Learning Collaborative and the Prenatal to 3 Policy Academy will seem a little bit daunting to those of you who have new governors in your state and may or may not know the key people to be talking with to try to be involved in this work. But we are hoping that you'll talk to your transition teams, as every outgoing governor has a transition team and every incoming governor has a transition team. They will be engaged with everyone in their states, learning as much as they can about what needs to happen. And if you can get talking to those folks and make those connections as early as possible, you can impress upon them the importance of these early years and encourage them to participate. So we encourage all of you to do that. The notice about the Prenatal to Age 3 Learning Collaborative will be going out shortly to all governor's advisors. The Education, Health, and Human Services advisors will all be hearing about that. And they will reach out to state folks to find out who will be the right people to send to that meeting. Similarly, the Policy Academy, which will begin in the spring, will host up to 6 states to be involved in that year-long process that will go from April to April. And we will ask states to submit a proposal a proposal for application. And those proposals will be reviewed, and we'll choose 6 states to participate in that ongoing technical assistance activity. So you'll hear more about that as well. But we're hoping that that states will think right now about the ways in which they can coordinate or are already coordinating services and supports for infants and toddlers so that we can highlight those at our meetings and in our technical assistance, as well as to encourage you to continue that work in your own states. So with that, let me turn it over to Barbara Gebhardt from 0 to 3, who is going to provide us with an overview of the Think Babies campaign and also highlight some additional resources and opportunities that folks can engage in to support infants and toddlers. And we'll remind you again to use the chat box if you have any questions, and we'll turn it over to you now, Barbara.
Thank you, Beth. It's good to be with everyone today, and I'm pleased to be able to give you a little overview of our Think Babies campaign. And also then we'll switch gears a bit after that and talk a little bit about some of the other resources that are available from 0 to 3. So on the next slide, we really created the Think Babies campaign at 0 to 3 to try to bring more nationwide attention to what babies and families need to thrive. The ultimate goal of what we hope to do is develop a system of policies at both the state and federal levels that leverage each other to support infants and toddlers and their families. So this campaign launched at the federal level in 2017, and then we were able in 2018 to expand the campaign to include partnerships with leading children's advocacy organizations in 6 states, and also with a network of national campaign partners. Funding for this Think Babies campaign come from 2 sources, from the Perigee Fund, which supports both the public education and advocacy aspects of the campaign, and also the Robert Wood Johnson Foundation, which supports the campaign's public education activities. So we do continue to focus on the federal campaign even after adding these other aspects this year. And that happens in a couple of different ways. One, through a digital organizing method where we have a different theme for each month and really encourage people to be involved on social media and other digital organizing. We also have nationally a Strolling Thunder event annually, and I will talk a little bit more about that in just a minute. In addition, we have established partnerships with a broad range of about 44 national organizations who are supporting the Think Babies campaign, including NGA supporting the education aspects of that. But today I'm really going to concentrate on our activities in states. So if we can move to the next slide, this gives the 6 states that are involved in the Think Babies work, and also the organizations that are our grantees there. So we're increasing the capacity at the state level in these 6 states through partnering with state-based advocacy organizations to implement state-level Think Babies campaigns. We do overlap with several other initiatives through the Pritzker Children's Initiative and the Alliance for Early Success in some of these states, in Colorado, in Georgia, and in North Carolina. So that provides them an opportunity to leverage funds to do even more for infants and toddlers and their families. So 0 to 3 is providing these state partners with both funding and technical assistance. And the way that they're carrying out their work is that as they started earlier in 2016, they convened partners across both the public and private sectors within their state who were interested in focusing on infants and toddlers, and had that broad range of programs and services and policies that Beth talked about earlier. This group then assessed what the needs were and the opportunities to advance policies benefiting infants, toddlers, and their families. And the groups worked together to come up with consensus on what their policy priorities would be and what solutions they hope to focus on. They have now all identified their policy priorities, and they're in the process of developing plans that really will help move those forward, with an eye especially toward the upcoming state legislative sessions, but also with any needed administrative advocacy that they feel might move their priority areas along. So on the next slide, you'll see the policy solutions that were kind of a menu of solutions for the state partners to focus on. So during the first couple of years of this campaign, the state partners are advancing specific solutions to advance 2 or more of these policy areas. So these are the 6 policy areas that they are able to focus on. Every state, interestingly, is focusing on affordable quality child care. Others, some of them are focusing on other priorities, including the paid family leave, infant and early childhood mental health, home visiting, healthy nutrition and obesity prevention, and also access to child and family screenings, and then linkages to services. So this is what I call the kind of glue priority that holds it all together. So you can see on the next slide where we have had events that a signature event that we call Strolling Thunder. And this is kind of a play on words from the Rolling Thunder motorcycle event that comes into DC every year. So we started with a national Strolling Thunder in DC in 2017. And then we had another one in May of 2018 in DC. And each of our 6 states had their own Strolling Thunder event. Plus, we have an office in Los Angeles, California, and they also did a Strolling Thunder. The idea behind Strolling Thunder is to build the public and political will to act on issues that affect infants and toddlers. And it particularly is a way to bring family voices to policymakers. So families come to the capitals in their state or in their nation for the National Strolling Thunder, and they are able to tell their stories, raise their voice, and urge the policymakers to think about babies and as they're making decisions about policies that might impact those families. So last year we had a total of 8 Strolling Thunder events and plan to repeat that in 2019 as well. So on the next slide, you can see that a little bit of a time frame, and these are some fun photos from our national Strolling Thunder event. We've been lucky enough to have beautiful weather both years, and so we're on a roll now and hope that continues. Right now, during the fall, the Think Baby states are preparing for legislative sessions at a national level. Of course, we're thinking about the new Congress coming in and about education of policymakers post-election. Through beginning in January and ongoing, then states will be kind of executing on their policy priorities at both the state and federal levels. And I wanted to mention an event and a publication to watch for in February. We have a couple of times over the past few years released our state infant toddler fact sheets, which have information about demographics related to infants and toddlers in the state, as well as about various programs and services and the uptake on those programs and services in states. We are in the process of updating and revising those fact sheets at both the national and state level, and we'll be releasing those in February with a policy forum that will be held that month also to release these on the Hill and also to bring in some state partners to help champion how those might be used to push forward policies for infants and toddlers in their state. We do also have a date for our National Strolling Thunder next year on April 30th, so you can be keeping your fingers crossed for good weather for us. And then on the next slide, we just want to again thank our supporters, the Peergy Fund and the Robert Wood Johnson Foundation. And this is the website for Think Babies. If you're interested in any more information about what's happening either in states or at a national level, there are lots of great resources on that website. So I'm going to switch gears a little bit now and talk a little bit about some of the resources that 0 to 3 has developed over a period of many years that may be of interest to those of you working at a state level, either with your governor's office, with other state agencies, or others who are interested in pushing along infant-toddler priorities. So on the next slide is our most recent publication, a short document called It's Time for Governors to Think Babies. And if you would like to get to any of these, they're on our website at 0to3.org, or there are links built into this PowerPoint. If you want to download the PowerPoint, you can click on the document or hyperlink and get to these documents. This particular document is intended to be kind of a short and sweet document for educating governors and their new administrations in particular about what the roles of governors might be as champions of the needs of babies. It also includes a bulleted list of some suggested actions in the first 100 days that can lay the groundwork for a governor's focus on infants and toddlers. And then there's also a list of some specific policy improvements that governors might champion in more of an ongoing way to meet the needs of infants and toddlers and their families. So this is a piece that I think could be a good education piece for new governors, as well as those who are kind of rethinking their agenda or trying to get more deeply into the early childhood space. We do have some other resources on the next slide that I wanted to highlight for you as well. The one in the middle is a self-assessment toolkit that is hyperlinked, the first hyperlink down there. And this is a toolkit that we developed to help state policy leaders and advocates look at the current status of services for infants and toddlers in their state. And then based on that, look to set priorities for improvement. The toolkit is divided into 3 content areas: good health, strong families, and positive early learning experiences, which are the policy areas of 0 to 3's policy agenda. And then a separate section on collaboration and system building for some of the kinds of policies that really go across those 3 content areas. And for each of these goal areas, the toolkit prompts you to first collect data on how infants and toddlers are doing in your state. So we've made it as easy as possible to be able to click a link and see what the national data is and then what the data is in your particular state. After looking at that demographic data, then there's a section of that toolkit that lists various policies so that you can examine whether your state has these recommended policies in place and look at those gaps that you might still have. Then there's a section on that focuses on whether federal or state funds are allocated to various services that support infants and toddlers and their families. And finally, there is a stakeholder survey and a family survey. And those questions can be used in a format like a SurveyMonkey format to gather input on how services are actually being delivered in communities around your state. So it's a pretty comprehensive document. However, we hope that it's user-friendly and would encourage states, if they don't have the bandwidth to do the entire thing, there may be pieces that you want to look at, like looking at your policies or looking at what family are experiencing related to services for their infants and toddlers, so that it doesn't have to be the entire tool at one time. The second resource I wanted to talk about sort of grew out of states looking at all of their needs and feeling a little bit overwhelmed and maybe not knowing exactly where to get to start. So the document called A Place to Get Started describes 8 strategies that policymakers can consider as they determine how to get started in innovating around infant and toddler policies. Each of these 8 strategies then includes 2 examples of states that are currently implementing that strategy. So there are a couple of paragraphs that have a quick highlight of how that is being implemented in different ways in 2 different states. And then the last document on the right is a policy brief that describes the experiences that we had in working with 3 states, Indiana, Oregon, and Vermont, to develop infant-toddler policy priorities and then begin to take action in advancing them. This is work that was funded by the Kellogg Foundation a couple of years ago. And so we captured some of the lessons we'd learned that I think can be helpful to other states as well. Then lastly, I wanted to, on the next slide, tell you a little bit about a series of papers that have been in development for the past year and a half. And this is a series that's produced by 0 to 3 and the Center for Law and Social Policy class with funding from the Kellogg Foundation. It includes a framework that outlines the needs of infants and toddlers, and you see that the brief version of that in the graphic that's over on the right side there. It also includes a paper that has the rationale for investing in programs to support children's development in the earliest years of life. So that's the paper called From the Ground Up, is really making the case kind of paper. And then we have 13 papers on policies that are core to advancing infant-toddler well-being. So there are papers, for example, on health insurance, on health care, treatment for health care issues, on education and workforce, on early Head Start, on child care, on Part C early intervention. So these are just a few of the 13 core policies that we have a paper on, and the papers really are a brief look at what is the current status of that policy across the country and what's the rationale for the importance of that being a core policy. We also have 3 other papers that will be forthcoming in the next couple of months, so you can keep an eye out for these. One is looking at the racial inequity in policies that impact infants and toddlers and families, and examining how public policy can undermine the healthy development of young children of color. The second one is a brief report on 6 policy opportunities that we think are timely and ripe for action and already have the groundwork laid at the local, state, or federal level. So again, I think this is a good short document that will be great for educating new policymakers about what they might be able to do in a short period of time, because the groundwork is already laid for these policies. And then lastly, we are working on a series of case studies and a companion brief that highlight how 4 states, Colorado, Illinois, New Jersey, and Washington State, have engaged in cross-system collaboration to better serve babies. So I encourage you to check out any of these resources that you might be interested in, either by clicking on the links here or by going to our website. All of these resources are at www.0to3.org, And then if you look for state and local policy, these and many, many more resources are available there for you to peruse and hopefully use in your education experiences with policymakers. So Beth, I'm going to turn it back over to you to see if there are maybe some questions or other things that you might want to add.
Thank you so much, Barbara. And while we're looking for questions, I just want to let everyone know that in the right-hand screen on your webinar, you can see two handouts. One is the slide deck from today's PowerPoint, and that has all the active links in it for all of the resources we've talked about today, as well as the Prenatal to Age 3 summary report from our expert roundtable as well. So we have not received any questions, but we'll hang around for a couple minutes in case anyone has any questions now. And while you're thinking of your questions, I just want to highlight that there is an awful lot of energy and interest in making sure we're thinking about how to integrate services and supports for infants, toddlers, and their families. And so we encourage you all to keep an eye out for these new resources as they come up, and for the lessons that we're going to be learning from the various activities going forward. We would like to be as supportive as we can in helping states think through how they might better integrate and support kids and families, knowing that there are a lot of places where children and their families can fall through the gaps, and where we can try to maximize the limited resources that we have in this area to get it where it needs to go as timely as possible. So with that, since we have no other questions, we'll end a few minutes early and give you all back a little bit of time to peruse these resources. We can leave this up for a few moments. In case you want to make sure you download those two documents, we'll also be sending around to everyone who registered for this webinar. We'll send around those slides and the report link, and also a couple of quick survey questions for you so that we can continue to improve the work that we're doing. And we want to thank you all very much for joining us today, and we hope that this energizes you and gives you some thoughts for how you can move forward to support the infants, toddlers, and their families in the states around our nation. So thank you all very much for joining us, and have a terrific afternoon.